Good morning. It's great to see so many of y'all here this morning. My name is Jill. I am the social worker in the Family Resource Center here at Scottish Rite for Children. It's good to see some familiar faces. Part of what I get to do is to work with adults and former patients and their families. And
And my name's Lillian. I am actually the social worker for the Spina Bifida Clinic here at Scottish Rite. So, as our young adults are transitioning out, they will leave me and come to you guys.
so we only have about an hour with y'all this morning, and that is not a lot of time to cover a huge topic. So this morning we're going to be presenting on navigating insurance and knowing your rights for catheters and other supplies. We'll have some time for questions at the end. Does everyone have a copy of the presentation and the two handouts? Yes. I think they were passing out both our business cards as well, and there's some extras over on the table where you came in. I know that and I'm sure Lillian as well, would always be happy for anyone to call or send us an email. If you want to email us and get a copy of the presentation emailed to you so you have the live links for the website, then feel free to do that as well. So we'll go ahead and get started. Does everyone have the handout that you need? Yes. All right. So there are several key ways that adults are able to get health insurance coverage. I've listed these here, and then we're going to go in more detail about the most common ways. Um, so there are government programs such as Medicaid and Medicare. We'll talk more about Medicaid coverage in a few minutes. A lot of people are able to get health insurance through their employer or maybe their spouse's employer. Also, up until the age of 26, young people are able to get health insurance through a parent's plan. So if a parent has coverage through their employer, then they're able to access that coverage. For people who have disabilities, there are some eligibility requirements, but they're sometimes able to stay on a parent's plan past the age of 26. There's also the health insurance marketplace. We'll talk a bit more about that. They do have an open enrollment period at the end of the year, every year, where you can sign up for a plan. Of course, you can always purchase a plan directly from an insurance company, or you can go through a registered agent to buy a plan through a company. And then some colleges offer student health plans for enrolled students. So SSI is a common way that people in Texas who have disabilities, who are adults, are able to access Medicaid coverage. I do want to note that just because someone was eligible for SSI as a child, they aren't necessarily eligible for SSI as an adult. So there is a recertification process when someone transitions from childhood into adulthood. SSI provides monthly payments to people who have disabilities, also some older adults. In the state of Texas, someone who receives SSI coverage is eligible for Medicaid coverage. Once you go through the process of applying for SSI and are approved, the Social Security Administration will send information to Texas Health and Human Services, and they should send you information about your Medicaid plan. If you don't get that in the mail, or if you have questions about which plan you have, then there's a number on your slide for the Texas Enrollment Broker Helpline. They can confirm your plan for you, and you can also select a new managed care organization if you're wanting to change your plan. There's also a link on the slide for the application process for SSI. I do want to caution that it can be a lengthy process, and there's more information about starting that here on the slide and on the website. They are going to consider someone's income, how many resources they currently have. They're going to look at disability and age. for some of that as far as eligibility criteria. And then Medicaid waivers. I listed some of the most common waivers that adults with spina bifida may be eligible for here in Texas. Each state has their own Medicaid waiver programs, and they don't transfer from state to state. So if you're considering a move and have a Medicaid waiver here in Texas, it won't transfer to another state, unfortunately. Medicaid waivers waive the traditional or some of the typical Medicaid requirements for coverage. And they're going to provide regular Medicaid coverage plus some extra added services, including, depending on the waiver, an extra budget for additional therapies, sometimes extra dental work. Some have residential options available, attendant care, home modifications.
Home and vehicle modifications that on a limited basis.
So it's going to depend on the waiver, and if you have a waiver, then you'll have a service coordinator who will help you set a budget for your waiver services for the year. To note about the Medicaid waivers, you can be on the wait list or the interest list, they call it, for multiple waivers, but you can only have one Medicaid waiver at a time. I encourage people to get on the list if they're interested in a waiver for as many waivers as they may be eligible for or think they're eligible for. Your name will be moving to the top of the list. And once you're at the top, if you decide you don't want that waiver, you don't have to take it. Once you're at the top of the list or near the top of the list, then they will talk to you about their eligibility requirements and get more documentation from you at that time. I do want to caution that unfortunately, the wait, the interest list for most of the waivers is quite long. The exception of that can be the Star Plus waiver. If you have Star Plus Medicaid and are interested in the Star Plus waiver, then you can contact your service coordinator directly. Otherwise, the other three waivers that we have listed, HCS and Texas Home Living, you would go through your local LIDA, which here in Dallas would be MetroCare. In Tarrant County would be Tarrant County MHMR. In Collin County would be LifePath. It's typically the local MHMR for counties who have Medicaid or MHMR coverage. Some of the waivers offer coverage for people who have what's termed a related condition. Spina bifida is often considered a related condition for those waivers, so that's something to note. They do have income eligibility and asset limits for all of the waivers as well. For the class waiver, there is an interest list line that you can call, and that number is on your handout as well. Additionally, there's a Medicaid buy-in program for adults in Texas who have disabilities and who work. Eligibility is going to be based upon having a disability. They will look at income and assets, and you must live and work in Texas. This is a way for somebody who has, who may work and make too much money to meet SSI requirements, to maintain SSI and their Medicaid through SSI. This is a way to have Medicaid coverage. To note, with the Medicaid buy-in program, there's often a monthly premium that you'll pay for your coverage. So that's the buy-in part. You'll actually buy in to have Medicaid coverage. So there will be a monthly premium requirement. That will be based on the individual's income. And there is a website listed here that you can go online and start that application process. You can also go to your local Health and Human Services office, and there's a site here to find the one that's closest to you. Right. So we're going to switch gears to commercial coverage now, which would be getting your healthcare coverage through either an individual plan or a group plan. So an individual plan is when you buy a plan directly from an insurance company, or you may go through a registered agent who helps you purchase that plan directly through an insurance company. Another way to access an individual plan is by going through the healthcare marketplace. And the open enrollment for those plans will be November 1st through December 15th of each year. There are some exceptions for a special enrollment period, and we'll talk about that in a bit. The other way a lot of people access healthcare coverage is through an employer-based healthcare plan, so through your job. Not all employers are required to offer healthcare coverage, but many are, depending on how many employees they have. One thing to note with employer-based plans is that the open enrollment period can vary. So typically human resources at a business or company, an employer will let staff know about that open enrollment and period and their options. So just a little bit about the healthcare marketplace. You may have heard of Obamacare or the Affordable Care Act. Those are the plans that are available on the health insurance marketplace, or you may hear people call it healthcare marketplace or just marketplace.
Exchange as well. Exchange plan.
Yes, exchange plan. Thank you. I have put the website and also the phone number. Those are the two fastest and easiest ways to access information about marketplace plans. There are some eligibility requirements to be able to shop on the healthcare marketplace. So you must be a US citizen or national or lawfully present non-citizen, and you must be currently living in the United States and not have Medicare coverage. We mentioned the open enrollment for the health insurance marketplace or healthcare marketplace. You may be eligible for a special enrollment period if you've had a life change. A life change could be a move, it could be losing health insurance, it could be a marriage or having a child. There are a list of eligible life changes. So if you've recently lost coverage, you may have the option of a special enrollment period on the healthcare marketplace. The other advantage of healthcare marketplace plans for some people is depending on your income, you may be eligible for a premium tax credit. And you can use that tax credit to help pay for the monthly premiums for your plan. So you may be eligible for reduced costs for healthcare coverage. So a few words to know. I just said the word premium. Premium would be the monthly fee for your coverage. So these first few words are going to apply more for commercial coverage. They won't apply for Medicaid coverage for most individuals. If it is the Medicaid buy-in, though, then you may have a monthly premium. But that's what you're going to pay each month to have the coverage. The deductible will be the amount of money you must pay before your plan kicks in and starts paying for the year. That is the reason why some people right now have higher medical expenses in January and in February. When the new year starts, the deductible starts over. And so if your plan has a deductible, then in January of each year, then you start meeting that deductible again. You have to pay up to that deductible before the healthcare plan starts paying. And again, not all plans have deductibles. A copayment is a fee that you pay for a healthcare service that's covered by your plan. And the copayment may be different depending on which service you're accessing. So if you have a sick visit with your primary care provider, you'll probably have a much smaller copayment for that visit than you would if you go to the emergency room, for example. That copayment's usually going to be a lot higher. Coinsurance is a fee, and it's often a percentage. So you'll see like maybe 20% of the cost or 30% of the cost. But it's a fee that you must pay for a covered service once you've met the deductible. So for example, say your doctor orders an MRI. You've already met your deductible for the year, so your healthcare plan is helping to pay for your covered expenses, but you have a 20% coinsurance. So even though the MRI is a covered health service, you would be responsible for paying 20% of that cost, and then your health plan would pay the remainder since you've already paid the deductible for the year. Out-of-pocket maximum is a really important term to know. That's the yearly limit that you'll pay for covered health service expenses. So that doesn't include premiums, but it does include other expenses you may have for covered services. So back to the example of the MRI, for example. Your doctor orders an MRI, you've met the deductible, but you've also met the out-of-pocket maximum for the year. Say your out-of-pocket maximum is $3,000. You've already paid $3,000 for healthcare already that year. Then your insurance is going to pay 100%, and you won't be required to pay that 20% coinsurance because you've already met your out-of-pocket maximum. So when you're shopping for a commercial healthcare plan, it can be really important to look at that maximum, that out-of-pocket maximum number, so you'll know what is the most that you'll be required to pay for covered services for the year. Network is really a list. It's the providers. It could be the doctors or other healthcare providers that your health plan has contracted with to provide the services that the health plan is going to cover. So for example, a commercial plan and Medicaid plans are going to have a provider directory. You can usually find those on their website, but you can also call a service coordinator or a caseworker with the plan. You can call the plan directly. There should be a customer service number on the back of most of those cards. And they can give you your network or your provider directory, your network of providers. So you can get a list of all the primary care doctors who are in network with your particular plan. If you go to one of the doctors in the network, they have a contract with your insurance company. Your insurance company is going to pay them and cover your expenses according to the terms of your particular plan. And then finally, a formulary is a list of medications covered by your health plan. So it's a list of medicines that your plan is going to pay for or help cover a percentage of. One thing to note about the formulary is it could be the same medication, but in a different form. So say a medicine comes in a pill and a medicine comes in a liquid. The formulary may cover the pill, but not the liquid. Or it could even be a dose. It may cover a certain dose, but if the doctor prescribes a bigger or smaller amount, it may not cover a pill of that size. So it's important to look at the formulary if you're having challenges with your plan covering a particular medicine. There may be, if you ask your doctor, an alternative that your plan would cover and would be acceptable to your doctor as well.
And I would say being mindful of the list of your in-network providers and the formulary are two of the best ways that you can minimize your out-of-pocket costs, because a lot of the commercial plans may have tiers of, these are our preferred providers and they offer the lowest cost, and so that's a really good way to be mindful and keep those out-of-pocket expenses lower.
That's a good point. More and more commercial plans are starting to have different tiers, and you may even have a different co-insurance or co-payment depending on what tier that provider falls into. All right, just quickly, as far as your rights with health insurance coverage, a healthcare plan cannot deny coverage because of someone having a pre-existing condition or a disability. That cannot exclude being accepted for a plan. Preventative services are 100% covered when you go to an in-network provider. So if you're going to get an annual physical, for example, that is a preventative service that should be covered at 100% as long as you're going to a doctor that is in the provider directory for your plan. If you see someone who's not in your plan's directory, the plan doesn't have to cover it. But if you go to someone in network, they will cover that at 100%. Insurance companies can't set an annual or a lifetime dollar limit on essential health benefits. Now, they can set limits on some services. So, for example, your plan may say you can only have 20 physical therapy visits a year, for example. But your plan can't decide in June, oh, you have spent all of the money that we will pay for the year. It's June. We're not going to cover anything from July to December because you've hit a maximum dollar amount. There is not a maximum dollar amount for the year or for lifetime. Plans must also have an adequate network of providers. Everyone's definition of adequate varies. I will say some plans, it can be challenging to find certain types of specialists who are nearby and are in network with your plan. That's one thing I caution when someone's looking to select a new plan is to take a look at the provider directory. Make sure the doctors that you're seeing or who you want to continue seeing are in network with that plan. But just know if, say, your primary care doctor refers you to a certain type of specialist, you look in that provider directory and you don't have someone in network with your plan of that specialty, you can contact the insurance company and get an out-of-network agreement. So you'll have to advocate for yourself that they are required to have an adequate network of providers available to you. And finally, you always have the right to appeal if your plan denies a claim. If you disagree with that, you can appeal. If they try to cancel your coverage, you always have the right to appeal that decision. And then a few resources for help. The Aging and Disability Resource Centers. This is a wonderful resource if you have questions about applying for Social Security or some of the Medicaid plans, and also other long-term services and supports. You can call that number listed, and they will connect you to your Aging and Disability Resource Center anywhere in the state of Texas. The Texas Department of Insurance is also another wonderful website. I use this website myself frequently. They have information about all different types of insurance, but a lot of really good information about health insurance coverage, especially if you're interested in purchasing a commercial plan or understanding your rights or understanding health insurance terminology. They have on their website, if you go to that link at the top and click on consumers, then you can select health insurance. They have videos you can watch. They have guides, a lot of additional information there. They also have a consumer helpline. If you have questions about insurance, you can call them during business hours. They're happy to help. I wanted to mention the Ticket to Work program. Unfortunately, we don't have a lot of time to go in a lot of details about it, but for someone who has SSI and accesses their Medicaid through SSI eligibility and is wanting to work, you do have the option of working, and the Ticket to Work program through the Social Security Administration can help you work, get back to work, or start working. They have work incentives. so you can maintain your Medicaid coverage and other benefits for a period of time. You can try out working if you want, and there's not a penalty if you decide not to continue working. But they are also they are the source of information for knowing the limits of income you can make through a job and also maintain your Medicaid and SSI benefits. I also linked a brochure through the Social Security Administration with a lot of good information. I mentioned the Texas Enrollment Broker Helpline earlier. That is a number that you can call to confirm which Medicaid plan you have. If you have Medicaid coverage, confirm which MCO or managed care organization your Medicaid plan is through. That's really important because that's how you know which provider directory you have access to with your Medicaid. But you also have the right to change your MCO, and that's where you can call to change your managed care organization as well. And then quickly, there's some people who may not be eligible for health insurance coverage, or it may be cost prohibitive at the moment. There's a lot of different reasons why someone may not currently have healthcare coverage. And you may still need different equipment and supplies even when you don't have healthcare coverage. So it is important to be able to access healthcare. That's how you'll get a prescription for your equipment and supplies as well. So briefly, there are county indigent healthcare programs. For those of you in Dallas County, that would be through Parkland. For those of you in Tarrant County, that would be through John Peter Smith, JPS. But every county in Texas has an indigent healthcare program. You must live in Texas, but you do not have to be a U.S. citizen in order to be eligible for county indigent healthcare program. They do look at your income and your resources. I went ahead and listed the statewide number for county indigent healthcare program. You can also look up your individual county. If you were to search on your phone, county indigent healthcare program, put in your county name, it'll typically bring up that information as well. You can access federally qualified healthcare centers or nonprofit and community clinics. And those are ways that you can see a primary care doctor and often other specialists, other medical providers like dental and mental health for low cost and often free services as well.
So we are going to switch gears a little bit and talk about catheters, which you've seen me in spina bifida clinic. I feel like it's all I get to talk about. So I'm going to talk to you guys about vendor selection, getting your supplies, things like that. And Jill and I are kind of yin and yang. So if I'm talking too fast, give me a little signal to slow down. So choosing your supply vendor, it's very important that your first consideration is whether or not they're going to be in network with your insurance coverage. There's an example of the back of my insurance card. And so you can see where I've circled, there's a phone number and there's a website. So I can go onto myuhc.com, pick the plan name that's listed on the front of my card, and see a list of all of the vendors, doctors, everything that is in network with my insurance company. That is going to be the best way to make sure that you're not, paying full price for your supplies, or getting charged exorbitant amounts. So first off, I would say searching your provider directory, asking your doctor if there's a social worker at your provider's office. Ask us, because we know we're filing the paperwork. We know who responds. We know who doesn't. We know which vendors families are coming in and asking to switch from. So ask your doctor, ask your support community, ask each other. You guys have the best recommendations on who gets your orders right, who knows your supplies, things like that. There are also patient care programs. A lot of the major brands have a program where they'll send you samples. They have people you can connect with. Convatec has the Me Plus program. Coloplast has their Coloplast Care program. Those are ways that especially if you have a specific brand and catheter that you like, they can help make sure that you're using a vendor that's in network, but then that they're also honoring your request and supplying you with the supplies that you want. So some things that I want all my families to know: you have the right to choose your vendor. Your doctor's office may say, oh, okay, we'll get those orders sent off for you. You may not know where they're sending it. You have the right to say where they go. There may be, some people they work with most often, and so they can give you those recommendations, but they can't choose for you. Also, the manufacturer can't choose for you. If you do the Coloplast Care program, they may say, oh, we'll send it to our affiliated, DME company. It does not have to go there. It goes to wherever you decide you want your supplies to go. You can even ask that your doctor provide you with a prescription. You can get a physical copy of it. I always recommend that. That doesn't list a vendor. It is not necessary for your orders. And then you can provide it to the vendor of your choice. You can also change your vendor at any time. You go with vendor A, they're sending the wrong supplies. You want hydrophilic, they're sending you uncoated. You keep telling them to stop doing that and they won't. Change your vendor. You can change it anytime. And, the same groups that I recommended reaching out to, they can help with, helping you find a vendor that's going to honor your wishes. You can have specific products requested. There are some kiddos that I see in clinic that Sheila says the only catheter they can use is the olive tip coude. So that's what they need. And so in those instances, I highly recommend having your doctor specifically write that as the prescription, not, uncoated coude catheter, Coloplast olive tip coude. Then that is stronger reason why the vendor has to honor that. And then you can also ask them for an estimate. Have your prescriber send the order over. Ask them how much it's going to cost you out of pocket. Ask them for an estimate. If it's cost prohibitive, ask them if there's another option. Hydrophilic catheters tend to cost more than uncoated. So if that's something that can work for you, you can do that. That's especially good in the beginning of the year if you have commercial insurance and having that deductible reset. Because a lot of people will get that first supply of the year and then sitting with a $700-800 bill because their deductibles reset, so they're paying the full price for those supplies. So things like that can kind of help save on costs and avoid surprises. Things that are important for you guys to be mindful of, especially if you need to receive medical supplies on a monthly basis: keeping care with a primary care provider. If your specialist is unable or unwilling to write for your supplies, that falls on your PCP. So it's good that you have a good relationship with them and that you're seeing them on a regular basis. If you have Medicaid, you have to see your provider within 6 months for them to write you a prescription for catheters. So if it's been 9-10 months and you haven't seen them, but your prescription expired and you need a new one, they're not going to be able to write it. So having those regular visits, making sure you're keeping track of your follow-up, helps prevent delays in supplies. I do also have some options if that becomes an issue and you can't get access to a prescription. Knowing your stuff.
Lillian, if you are needing a new primary care doctor, if you don't have one you're established with right now, a lot of primary care doctors have a several-month wait for a new patient visit. So if you're going to be anticipating you're needing a supply order, you need a new PCP to sign for those, go ahead early and schedule that new patient appointment.
Yes, and I would also say to schedule, because you may schedule with a provider you don't know and decide you don't like them. And that's okay. Not every person is going to be a good fit. So go ahead and do that early so that you're not in a pickle and you don't have one. You've got time to shop around and find somebody who really fits you. So yes, knowing your stuff, know what supplies you need. Know how many, keep in mind how many times a day are you cathing? Do you need incontinence supplies? Do you need, a specific type of lubrication? Things like that you need to know. That way, if you do switch PCPs or there's another urologist standing in for your urologist, you can make sure that everything is correct because you can tell them exactly what you need. You don't have to rely on them hunting through notes that might be old or outdated. Know your vendor. Have their phone number saved in your phone. It's important because that's who you're contacting every month to reorder your supplies. So you need to have that number in case anything goes wrong, in case your shipment doesn't come in. You need to know who it is and how to contact them. Always have a copy of your insurance card. Not everybody is great about that, but you need to know who you're insured through, what kind of coverage it is, and what your plan is called. Because y'all saw my insurance card, United Healthcare. United Healthcare has like 150 plans. So it's important what specific plan you have, not just what company. And then knowing your provider. When you've got 4 or 5 specialists, it may be hard to know who writes for which supplies. Especially with adult healthcare, it can get kind of muddy. Your urologist may write for your catheters, and your PCP may write for the briefs and wipes, and your GI doctor may write for your Paracine. So knowing who writes which prescription, because all that paperwork has to go to the right provider. If you lose or change your coverage, please notify your vendor ASAP. That can help avoid getting a month's worth of supplies where you weren't covered and now you've got to pay the full expense. If you do lose your coverage, they can help you navigate that sometimes and may have some options, like some vendors have a financial hardship program that can kind of help bridge that gap. You may qualify for COBRA, which is continuation when you lose your insurance, like after leaving a job, the special enrollment periods. There are other things that you may qualify for, but you've got to let somebody know so they can kind of point you in the right direction and get you connected with the right people. That's another way the Aging and Disability Resource Center is a great option. They have benefits counselors that can kind of help talk you through all those different things. Some important questions to ask when you are considering a vendor. Do they carry all the supplies I need, or do I have to piece it out between vendors? Some vendors carry nutritional supplies. So if you need enteral nutrition, a vendor that carries urological supplies may or may not always have that. So knowing the full scope of supplies you need and whether or not that vendor can supply everything, or if you've got to piece it out, because sometimes having more than one vendor can be a huge headache. And so that's another way that your provider social worker, if they have one, can help you. If you say, well, okay, I know you guys are writing for catheters, but I'm also getting nutritional supplies through XYZ Medical, they can kind of help figure out, well, can we go ahead and send these orders over there, or do we need to help you find somebody new? And that's, again, where that you can change vendors at any time comes in handy. And also, not all vendors carry the same brand. So again, if you're particular about what supplies you need, or if there's a specific catheter that works best for you and your lifestyle, asking them what brands they carry or what brands they would be able to get for you so that you can make sure that you've got what works best for you. Because in the end, that's the important part. Knowing how you're requesting your supplies every month. Some vendors will call you. They will call you like clockwork. They'll call you at the beginning of the month, ask you how you're doing on everything, what you need, and fulfill your orders that way. Some have an online option if you don't want to have to talk to anybody. Some will have an app. Some of the vendors, you have to reach out to them. And if you don't reach out to them, they're not going to send it to you. On the other hand, they may have you set up for auto ship. And so unless you reach out to them, they're going to keep sending it to you. And maybe you've got a wall full of, briefs stacking up in your closet and you don't want them to send anymore. So knowing how you order your supplies every month, how you're going to make sure you get them is important. If you don't want to have to talk to people, if you don't want to have to worry about waiting on hold, you want ease, asking if they have an app. A lot of the big national ones will have an app or just like a link on their website where you can go online and do it. Knowing if they have staff or interpreters that speak a language that you're comfortable speaking in, that can be extremely important. So knowing whether or not you're actually going to be able to communicate with them is helpful. And then asking about those out-of-pocket costs. Ask if they charge shipping or delivery fees. Getting an idea of what that's going to look like in the beginning of the year when your deductible resets. commercial insurance plans. If you've got Medicaid, typically that's, you're not paying those costs. If you've got a commercial insurance plan, your deductible is going to factor in, your copays and co-insurance are going to factor in. So wanting to make sure that that is something that's affordable for you. And that's also another thing to consider if you're debating between maybe like a marketplace plan or applying for Medicaid buy-in. It may be a similar monthly premium, but a lot of commercial plans don't cover the incontinence supplies like briefs, wipes, the barrier pad. They don't cover that. And so in the end, it may seem like it's a comparable cost, but in the end, that Medicaid buy-in would be a lot more cost effective because you wouldn't have to pay for those extra supplies.
If you have a Medicaid plan, a vendor can't charge you for your supplies. There's no co-insurance or affiliated with these. Covers everything. Something that I encountered recently was someone who was being charged, they have Medicaid coverage, they were being charged a shipment cost up to almost $100 a month for their supplies. There are other options for vendors. Called 3 more vendors, just immediately were able to find others who could fill that quickly and no cost should be associated with that.
Yeah, and don't be afraid to ask your vendor questions. Don't be afraid to say, hey, why is there a shipping fee? Why are you charging me a shipping fee and then sending my supplies out in 3 different shipments? Can't you send it all together? Ask those questions because that is not going to be your experience with every vendor. So this is my golden self-pay option. Should you not have insurance, not have access to insurance coverage, but you still need a cath, that's not going to go away. So this is a list of some online websites. Now I cannot 100% vouch for all of them. I will say that Medical Monks is one that I did have recommended to me by one of the manufacturer representatives. So I'll let him vouch for that one. And then I have helped families use the discountcatheters.com, not my favorite, and the HeyMed Supply. The important distinction, those 2 there at the bottom do not require a prescription. And also recently found out that Honest Med does not either. One of the handouts is this list with links to the website. If you want a digital version of that, please send me an email, let me know. I will be happy to send it to you. But these are all websites that you can purchase catheters from online. Some require a prescription, some don't. They don't utilize insurance, but a lot of the times the cost is much less than going through some vendors. And then you can also compare options like, do you want to go ahead and go with a hydrophilic, or do you want to go for a lower cost and go uncoated? Some brands are more cost effective than others, so you can kind of analyze all those options yourself and decide what's going to be best for you. I have some families with commercial insurance that will utilize this for the first month or 2 of the year when their deductible resets. They'll go ahead and stock up this way and get their supplies that way. And then once they've met their deductible, then they'll get them through their insurance because it's cheaper that way sometimes. It's going to vary based on your plan. But if you ever get in a situation where you don't have a PCP, you haven't seen your urologist in 9 months, you have no access to get a prescription, there are 2 options that you can purchase some catheters to bridge that gap if you're able to until you can get a new prescription. Some of them also offer subscribe and save options where you can get them auto shipped every 2-3 months and they'll give you a 10% discount, 5% discount, things like that. There are some, and it should be noted on the handout, some of them accept FSA and HSA funds, which we neglected to put on our definitions. FSA is a flexible spending account. That is money that can go into an account pre-tax that you can then use for healthcare expenses throughout the year. It's only good for that year, and sometimes if you have an employer plan, your employer may contribute some to it as well. So say you do have an FSA card and it's November and you've got $300 left on it. You have no idea what you're going to spend it on. well, you can go buy 2 cases of catheters and, use up those funds. And then, you have an extra backup supply of your stuff. There are also, if your insurance, commercial insurance doesn't cover briefs, wipes, those incontinence supplies, they are eligible for FSA. So you can use your FSA funds to purchase that so it's not coming out of pocket. There are also charitable organizations. I hope you guys know that Spina Bifida Association has a supply closet. So there are organizations that can help on a temporary basis. Emphasis on temporary. But Spina Bifida Association chapters, Neuro Assistance Foundation is a great organization that's helped a lot of our patients. Your local Center for Independent Living, Aging and Disability Resource Center can also get you connected with places. Jill or myself, Jill is in our Family Resource Center, and so, like she said, she works with non-patient and former patients. Or call me, you'll have both of our contact information. We can always try to help connect you with either an organization that can help bridge that gap, or reminding of the self-pay resources, kind of whatever would work best for you based on your situation. Another option, asking your doctor's office if they have samples. Reps love to come and just stop by with a case of catheters sometimes. So your doctor's office may have some extra supplies that they can float you until you get everything back on track. Some county indigent health programs may have access to assist with supplies. In my experience, it can be inconsistent, so I won't say 100%, but it doesn't hurt to ask that question. If you receive services through your county health program, ask if they can help with those supplies. The other handout that you have is our patient education on washing and reusing catheters. Our urologists feel very strongly that this is okay for clean intermittent catheterization. Dr. Jacobs in particular is very passionate about it and has sent peer-reviewed articles to school nurses. So I did include that because when you're in a pinch, that is a very good way to help stretch your supplies. It can only be done with uncoated. You cannot wash and reuse hydrophilic, only uncoated, but those instructions will help you be able to wash and reuse and stretch those supplies. I have seen some families stretch one box of 30 catheters over 5-6 months. So it can help bridge that gap. If you have a large gap of time where you don't have insurance or don't have access to getting supplies, it can help you in a pinch. And so I want everybody to know Sheila's little secret. Let's see. Oh, and that's it. Do we have time for questions? I think we have a few minutes. Any questions? We'll also kind of hang around for a little bit. I'll be here through lunch too. So if you've got a really specific question, feel free to come ask us. All right.
Oh, we do have a question.
Okay.
Great.
All that first aid stuff over. Yes, and some FSA. So the other distinction as well, because I've experienced this between my husband and I insurance. Some companies that provide that FSA, they'll give you a card, but you may not be able to use that card everywhere. It can be extremely frustrating. But if you're purchasing a product that does qualify for it, you can submit your receipt to get reimbursed. For example, the FSA card that I have through my insurance, I can swipe it for my copays at the doctor's office. For some reason, I cannot swipe the one my husband gets. It will not work. I have to submit that for reimbursement. So just because your card doesn't work doesn't always mean you can't submit that for reimbursement. If it's an expense that qualifies, you can submit it to them. They usually will have a form on their website that you can fill out and get sent in. Same thing for those websites. If they say they accept FSA, then you should be able to use your card details to go ahead and directly use your funds. But if not, get an itemized receipt. They will provide you with a receipt that you can then submit to your company to get reimbursed for those supplies. Oh, I would love to see that. And I would honestly trust y'all's spreadsheet over mine because y'all are going to know, hey, they messed up my order 3 times, don't order from them. Y'all have that experience. Y'all are going to be the best to know. So if it ever comes between my expertise and y'all's, y'all are the experts. So supplies wise, it's going to depend on the supply. I actually tried this yesterday. You can search and find catheters online, but then Amazon says that you have to have a like business account. So it looks like as just a regular citizen, supplies won't work. Now, briefs, wipes, things like that, depending, some of those can be better priced. When looking for families, it seems like some of these typically have a better price than Amazon, particularly if they let you buy the larger packages like a case rather than just like a pack of 14. Yeah, if you ever come through family services one day and see me crunching numbers at my desk, it's because I'm doing what I call diaper math to see what the cheapest option is for a family. But usually it's, unfortunately, it's not Amazon, but it can be great for getting it quickly. Anybody else? And I'm going to put him on the spot. A great person to speak with is Brian back there because he's very helpful. He's with Maxwell. Well, if you have other questions, I mean, honestly, feel free to reach out to us. Give us a call. That's both of our direct numbers. Send us an email. We are more than happy to help you guys navigate this stuff. All right. Thank you. I'm going to leave that up so if y'all need to write it down.